work, what are some actionable things they could do to really work to solve the problem?
Well, first thing, I think that if the individuals that are leading the process that come together, they need to understand what is that organization's strategic goal. If that strategic goal is to be the community of source for, population health, to make sure that if, for like in Tennessee, the biggest issues, congestive heart failure and diabetes. If that's where your highest amount of readmissions are, you're going to want to focus to that amount of core data to make sure that if you have your record that you were at this facility and you were being monitored for congestive heart failure, then you go here. Are they keeping that information consistent? Because if it gets a little out of whack, either one of those usually causes a detrimental effect, and that patient winds back up in the hospital, and then that's costly. So you want to know
a dedicated goal, a shared goal that everyone understands.
It's a shared goal that everybody understands. When I was still working in a large healthcare facility, where we started that goal was because we were under the we were under the direction. Also, we were being told.
You were commanded.
We were commanded that we were going to be reducing staff. And the focus of our CFO was the fact, here is the patient to staff ratio, and we've got to get it under this number. So we were looking at, oh my God, if we got to reduce staff to this a patient ratio, where are we going to reduce? Well, they're not going to reduce it in clinical, because that's impacting directly customer service. So they're always looking behind the scenes, and I happen to always be behind the scenes. So we presented this process to let's look at registry data, because there was a tremendous shortage of RNs at the time as well. So we realized we had 15 registries. We had staff that was abstracting into those, and so we were able to take that group of RNs and move them back to the clinical front, and we were able to reduce that staff down tremendously that was actually abstracting data so that we could actually have information coming directly from the system. So we were able to take all of the registry data, the components, map that to each other. About 25% was coming directly from the system, and then we were able to take the other core components, and then it just left 25% that literally had to be manually abstracted out. So we were able to show that demonstration. The other thing that we that I've seen done, at my organization did this, I've seen this done at several organizations, is they actually hire an independent person that understands what you're trying to achieve, and they become the secret patient. So in other words, John, you come into the hospital and there's one doctor that's registering you in and signing you, but nobody else knows that you're really not sick. They don't know what's wrong. They're going, what's he here for?
Just to experience.
But you are then reporting back that whole patient experience, not only from a customer service standpoint. Did the nurse working on you lean over and she reeked of cigarette smoke? Did her thongs show on the back of her uniform? Those kind of things. You're also assessing the information. How many times did you have to repeat the same thing? How many different people? And that paints an interesting story. Sure. So if you don't have an immediate need that you can identify, having it from a patient's story perspective is another way that helps look at that, because it's really enlightening how many times the patients are asked the same questions.
Yeah.
And they're asked because the information...
The HCAP scores, which then
absolutely
hits the bottom line, which everyone loves to improve HCAP scores, right?
Right. So that's another paramount way of doing it, because then that tells you how your systems are fragmented, because a lot of facilities have allowed areas to buy best of breeds. In other words, nursing wanted this, or the emergency department wanted this tool because it was their best workflow tool. Right. But it doesn't feed information over to this tool. So when they leave the emergency room, and if
there's no connections, they ask again,
right,
what are
and you've got 35% of your admissions coming from the emergency room, then 35% of those patients have to repeat all of that information again.
And then you also have the risk that they're going to enter the information wrong.
Exactly.
Because they didn't get it corrected from the beginning. Interesting.
A lot of individuals have used information governance as the core content building as they build templates and templated documentation, so there's prompts so that the right information is gathered concurrently, because that's part of information governance too. So you want to build the principles and the processes as close to the patient as possible. So wherever the person is gathering that information by that patient, that's where you want to have that. And that's really just, from an analogy standpoint, that's totally different from the old medical record way, because in the old days, like when I started, in the olden days, you know, there could be all kinds of garbage in, and we straightened it out on the back end, and we cleaned up, and we got everything authenticated. You can't do that anymore.
No.
It's all created
Garbage in,
up front.
garbage
It's all
out.
exactly. So the core principles of HIM literally have to be embedded into your processes for information governance and pushed out. So it really takes the HIM world and takes the walls down and pushes it out throughout the entire organization.
What would you see as, say, the advanced organizations? What are they doing? And maybe beyond that, you know, what should they be doing that maybe we're not doing yet?
Well, many of the advanced organizations, not only they had already collaborated with that team, but they also have a whole informatics department. And so they really get into the core content and structure. So many organizations haven't even truly mapped their data content.
Yeah.
If
They
they'll
don't know where the leaks are.
they don't even have a clue. And if you ask them if they've done that, they'll say, oh, well, we have an interface map. You go over to IT and they'll have a map on the wall that shows the different systems of what's interfaced. And I said, that's good. You know the systems, but what's in each of those systems? And that's the difference.